major tranquilizers, BTNE, and final exam review. Ace-promazine, also called Prom-Ace. This is a tranquilizer from which family? This is a phenothiazine tranquilizer. What does it do to pets at risk for seizures? This is going to lower the seizure threshold potentially. This is one that is debatable, and in your textbook it does say that there has not been a lot of proof saying that it does lower the seizure threshold, but recent studies also have not been able to disprove this either. Which reaction can boxers have? That is called syncope. What does it do to emesis, arrhythmias, and histamine? This is going to be an antiemetic, antiarrhythmic, and an antihistamine. What does it do to blood pressure? It will lower the blood pressure, meaning that it can be very difficult to hit an IV when we need to. When is it contraindicated? At young and old animals, allergy testing, and during organ malfunctions. It can slow the metabolism of drugs as they leave the system, meaning that our very young animals can get hypothermic or hypoglycemic. They can recover very slowly, and likewise for our older animals as well. If they have a low metabolism, a slow metabolism, then it can complicate things. Diazepam, also called Valium. Remember, diazepam is the generic or non-proprietary drug. Valium is going to be the brand name, the trade name, and the proprietary name. Tranquilizer from which family? This is a benzodiazepine tranquilizer. Controlled? Yes, this is a control schedule 4. Avoid the brand or generic in cats. We need to avoid the generic in cats or diazepam because it will cause irreversible liver failure. It can work as an appetite stimulant and as an anticonvulsant. Routes of administration, IV, PO, and rectally. Reversed with flumazenil. Flumazenil will help to reverse our benzodiazepine tranquilizers. And what happens when stored in plastic? And what happens when it's exposed to light? It is sensitive to light, so that will reduce the efficacy, and it is absorbed in plastic, so it will not work as well if it sits in a plastic syringe for sometimes hours. Flumazenil, this is going to reverse our benzodiazepine tranquilizers. So it will reverse diazepam, also called Valium, midazolam, also called Versed, and zolazepam, which is half of tilazol. It will not reverse the teletamine in tilazol, but it will reverse the zolazepam. Routes, we're going to give this IV very rapidly for intravenous use. Midazolam, also a benzodiazepine tranquilizer. Controlled, schedule 4. Routes of administration, this can be given IV, IM, sub-Q, and in some of our patients, this can even be given intranasally, such as the route that we give a Bordetella vaccination in some of our pets. Reversed with flumazenil. On to our alpha-2 agonists. So our alpha-2 agonists, keep in mind, will provide analgesia and they will not be controlled. Detomidine, also called Dormosedan. As you can see here, we have our horses and their heads are down. So that means this is going to be helping to anesthetize our horses. Sedative from alpha-2 agonists, reversed with atipamezole, which is also called antecedin. Antecedin. This is going to help to wake them up, which is an alpha-2 antagonist. Analgesia, yes, this will help provide some analgesia. Not necessarily enough to reverse us or to provide analgesia for a spay, but this is enough to help with some very minor procedures. Which species? This is used for our equine species. Dexmedetomidine, also called Dexdomitor. Please note we have two different formats of it here. We have a 0.5 mg per mil and a 0.1 mg per mil. Dexdomitor 0.1 is used in our much smaller patients. That way we can give a easier to calibrate or easier to draw up amount rather than just a teeny tiny amount that can be very difficult to administer. Keep in mind, Dexdomitor 0.1 though, we may have to administer a considerable amount to larger dogs. So that's where Dexdomitor 0.5 mg per mil is going to be a better choice for some of our larger dogs. This is a sedative from our alpha-2 agonists. This is reversed with atipamezole antecedent, which is an alpha-2 antagonist. Analgesia? Yes. Which species? Dogs and cats. Cardiac side effects? Expect bradycardia. We can have a normal heart rate with Dexdomitor be considerably lower. Please keep your veterinarian advised as to what the heart rate is. And the concentrations come to us in 0.5 mg per mil and 0.1 mg per mil. The volume with atipamezole, when we are using the 0.5 mg per mil concentration, we need to give this in equal amounts. So 0.5 mg per mil is the only one that we can administer equal amounts with atipamezole, also called antecedent. Xylazine, also called Rompin. This is a sedative from our alpha-2 agonists. Reversed with atipamezole, also called antecedent. This is an alpha-2 antagonist. Xylazine and our other alpha-2 agonists can also be reversed with yohimbine, which is called Yobine. This is an alpha-2 antagonist, and can be reversed with tolazoline or tolazine, which is also an alpha-2 antagonist. So alpha-2 agonists are reversed with alpha-2 antagonists. Our Dexdomitor and our Dormosedan can also be reversed with all of them. However, keep in mind the concentrations of them are going to vary. And so if we tried to reverse Dormosedan with antecedent, then keep in mind that we would have to use, in some cases, very large quantities, which can be extremely expensive. So Dormosedan, usually it will be preferred to reverse with tolazoline. Xylazine will be reversed with yohimbine or tolazoline, and Dexdomitor will typically be reversed with atipamezole or antecedent. This will just be usually the most cost-effective with the various species that we're working with. Analgesia, yes, all of our alpha-2 agonists will provide analgesia until they are reversed by an alpha-2 antagonist or until it wears off. What else does it do besides sedation for cats? This will induce emesis, and xylazine has been used quite a bit in the past as the emetic of choice in cats, providing emesis for our cats. Dexdomitor can also be used at certain concentrations to provide emesis in cats as well. We always need to reverse it after emesis though. And which species is most sensitive? Cows are going to be most sensitive to our alpha-2 agonists. And cows, when given a horse dosage, could potentially die. So it's very important that cows get a significantly less amount than the horses do. Common concentrations, we'll see small animal concentration of 2%, which is the same as 20 mg per mil, and large animal concentration, which is 10%, which is the same as 100 mg per milliliter. Atipamezole, also called antecedent. This will reverse Dexdomitor, xylazine, and amitraz, midazolam. It can reverse Dormosedan, but again, very expensive at these concentrations. So it's recommended that atipamezole reverse dexmedetomidine as the most economical choice. This will reverse sedation and analgesia. So as soon as analgesia gets reversed, we need to consider if the animal needs additional pain control. Routes, this can be given IV, IM, and subcutaneously. And the volume when given with dexmedetomidine, 0.5 mg per ml concentration of Dexdomitor, dexmedetomidine, this can be given in equal amounts, but not 0.1 mg per ml. If that's the case, then we are going to have to go onto the manufacturer's website and make sure that we measure out how much can be administered to reverse the Dexdomitor 0.1. Polazoline, also called tolazine, this will reverse xylazine, rompin, detomidine, dormosedan, can reverse Dexdomitor as well, but again, the concentrations are not recommended in our small animals. This will reverse sedation and analgesia, and the routes this can be given is intravenously. Fast or slow administration, we're going to give this slow IV. We're going to titrate to effect, meaning we're going to drip little bits at a time until we get the desired response. Yohimbine, also called Yobine, will help to reverse xylazine, also called rompin, amitraz, midazolam. This can reverse the other alpha-2 agonists, but it is usually best used with xylazine and as a reversal for midazolam. This will reverse sedation and analgesia, and the routes we can use, IV or IM. Fast or slow administration, this will be given, if we're giving it IV, we need to give it IV slowly. Ketamine, Ketacet, this will be a dissociative anesthetic. This is controlled. The schedule is control schedule 3. What does it do to the seizure threshold? This potentially can lower the seizure threshold in some patients. And the volume with diazepam, when we're combining ketamine and diazepam, or ketamine and Valium together, we will use equal volumes when combined with diazepam, and these are given intravenously. They can be given in the same syringe, and we're going to use equal volumes. So if we use 1 cc of ketamine, we use 1 cc of diazepam. Keep in mind that ketamine and diazepam do have different concentrations and different dosages, but for that average 40-pound dog, we can use 1 cc of ketamine and 1 cc of diazepam. When combined with other drugs such as acepromazine, diazepam, midazolam, we can combine this often into the same syringe. Remember, we draw up 2 separate syringes and then we can combine into 1 single syringe. What does it do to the respiratory system? This potentially can cause apneustic respirations, where the animal breathes in, holds its breath, and then breathes out slowly, which can mean that we're using inefficient breathing mechanisms. Teletamine and zolazepam is also called tilazol. Teletamine is, see, these are 2 different drug families. Teletamine is going to be a dissociative anesthetic, and zolazepam is going to be a benzodiazepine tranquilizer. Controlled, what schedule? Tilazol is going to be a controlled schedule 3. I know that zolazepam, the benzodiazepine tranquilizer, is a control schedule 4. But often when we combine 2 drugs of different schedules together, the more severe schedule is going to be the one chosen. And so this is a control schedule 3. Shelf life, once reconstituted, this can be at room temperature for 4 days. This has to be locked under a controlled drug cabinet, or refrigerated, also needs to be locked, and it can be kept for up to 14 days.